Alright, hey, what's up, guys? So, thank you for clicking on this video to watch the video. It's been a long time since I've done pretty much any type of video or health update for you all. So, actually had to go back and watch my last two videos, and I never rewatch any of my videos ever. I just don't like listen to myself. I don't like the way I sound. It's just that weird. It's not a lot of people that like to listen to themselves, and I'm one of them. So I apologize, one, two, because it took me a while to do another video, and two, because the quality of this video is not good because of the lighting, and I'm kind of down right now. I'm not feeling too well, so I'm not in the area where I can get good lighting, and I definitely wanted to get another video out since it's been pretty much like 2 months since I've done a health update video. So I went back and I looked at my last video, my health video, not my hair one. And the last thing I was doing was getting infusion in Tennessee, in Franklin, at Vandy. And I was talking about how I was trying to get transferred to have infusions here in my hometown in Huntsville, Alabama. And that did happen. Yay. And I did have my first infusion here at the infusion center. I mean, I was excited about it. Any type of change, I go well with change. I flow really well with change, but when it comes to my health, I'm kind of timid. Like if I'm being treated somewhere, I get used to that protocol, what happens there. So I was kind of like, oh my God, this is going to be different probably. What if they don't know what they're doing? That type of worry. So I went. It's actually coming up on another infusion. I didn't record there because, not that I didn't think about recording, I actually did record one clip, but I didn't record further because I just didn't know how things were gonna go. So what happened is I actually love where I'm having infusions now. I have them at the hospital here in Huntsville at the infusion center, which is actually upstairs, right upstairs from my primary doctor and my GI doctor. So that's convenient. If I ever, well, obviously if I have an emergency, I can just go to the ER. I would need to go to the ER, but if I have like a minor emergency or concern, or if they have a concern, my doctor is literally 2 floors down. So I like that. I like the fact that at this infusion center, I actually can get a room. So I don't have to sit out like in a area designated for infusion like in Tennessee. It was just a room and different chairs, kind of spaced out and what have you. So I definitely, I'm about to sneeze. Okay. Excuse me. So I definitely like that about, the new infusion center. So it's more private, and I'm really not a really private person. I mean, I really don't care if I'm sitting in the room with people having an infusion because it's not like I'm without any clothes or anything like that. So it really didn't bother me, but I do realize that I do like, more privacy. I'm able to chill a lot more. If someone calls me, if I need to handle business, I'm behind closed doors. So I definitely like that about it. So that's one change since the last time I done a video. The second thing that has happened is I am starting pain management. At the end of my last video, you guys saw that I was in so much pain driving to my doctor's appointment. We had it out, guys. We had it out. He almost didn't even want to send me to pain management, which really made me upset because it's kind of just like, he was like, you're so young. I'm like, well, the pain and lupus didn't discriminate on my age. What are you saying? You're so young, I don't want to send you to pain management. But, I really didn't care. But when I say I was literally up in that appointment crying, like I was crying. Now, that's been the first time that I've cried because of, like pain or anything like that. I usually, when I get highly frustrated, and upset, and when I'm trying to express to you, what's going on, and the conversation's not going right, like, I will start crying because I'm furious. So I haven't done that in a long time. So he sent me to pain management, and guys, it has been definitely a journey. I haven't even started yet. So, like I said, it's been 2 months. So he sends me to this pain clinic. He sends the referral over. Did not hear from them for a week. And I'm a very patient person, but I've had enough. I didn't hear from them in a week to call and confirm an appointment. So I called them, and I called, my primary doctor, and I was like, I haven't even heard from them. Like, that's not even a good look to me. Like, that's not professional to me, because y'all haven't even called me. Even if there's no appointments available, to touch bases and say, we got your referral, we'll hit you back later, or, we don't have anything open right now, but if we do, we'll give you a call. Nothing. And I think it's been a while, so my mind is so foggy because there's so much other things going on, but I think it was 2 weeks. And during that time, my insurance company did not want to approve my pain medicine, which was oxycodone. And they wanted me to try morphine instead. And I was just like, you rather cover morphine before you cover oxycodone? Like, I was confused about that. And so that's one reason why I was calling my doctor that day, to let them know, I need something else that could possibly be covered. Long story short, he asked me about the pain clinic, and I'm just like, they haven't even called me. So, you need to be treating my pain right now. Pretty much that's how the conversation went on the phone. So, I was good after that. I went to the pain clinic. I'm not going to say which one I went to, but it was horrible, guys. Like, I'm going to put it this way. It didn't seem sanitary. Like, when you go to the doctor's office, the lobby is nice, and I'm not being bougie. This is a doctor's office. They do sanitary procedures, and they give you injections, epidurals, trigger point. They give you stuff there that requires sanitary procedures. And when I step into your lobby and it's crappy, the place is old, it hasn't been renovated, I know it's mold in there, like, I don't want to be treated here, so I have not went back. So for a while I was just frustrated, and I just got kind of irritated, and I wouldn't say I gave up. I kind of just took a break and was just like, you know what, I guess I'm going to just suffer this out for a little bit. Then all of a sudden, I guess my doctor noticed that I wasn't getting any treatment, because I didn't tell him what happened, but he wasn't getting any reports in from me. So I get this phone call from another pain clinic here, and they set me up. It took me about a week to get in. And like I said, I haven't started any treatments yet, but they do what's it called? An orientation. And it's like a group setting. They tell you basically how it's going to go. They tell you a lot about your, not your specific treatment plan, but just a general treatment plan for chronic pain. They also do counseling. So they want to make sure that, one, your mindset is proper and your mindset is straight, basically, before you go through any type of treatment for pain. Because if you do not have the appropriate mindset when you're being treated for anything, it probably won't work. So they do that. They do counseling. They make sure that you're not at risk for drug addiction. So they'll ask you about family history, about drugs and alcohol addiction. They ask you about your own personal use of drugs and alcohol and all that stuff. I haven't even got to that point yet where they ask me my own personal questions. So I'm actually getting ready to go in this upcoming Monday. And so we'll just see, where it goes from there. My computer just kind of went blank on me. So yeah, we'll see where it actually goes from there. So I'm really excited about that because I started watching some other YouTube videos and I came across this girl that had IC, and I'm not really sure what the disease actually is, but it's a lot of, she has a lot of pelvic pain and bladder issues, so she see a urologist, and her pain management clinic has tried everything that I have done before I've even started pain management. So they're gonna probably be like, there is nothing we can do for you, or they're probably gonna be like, jump to the most extreme measure of pain control for me, because I've literally tried it all. I've been on every antidepressant she listed that they tried with her, I've already done. And for some people that don't know, antidepressants are prescribed at a lower dose for pain management, not for psychotic reasons. For psychotic reasons, you're on very high dosage of antidepressants. So if you're getting for pain control, don't be alarmed. It works well for some people. They're not giving you a really high dose like they would for someone that needs it for psychiatric reasons. So I have tried 3 different ones: nortriptyline, Lexapro, Cymbalta. I just think that's a no-go for me. I already tried 3 of them. And that was 3 of the ones that she actually tried. We've tried injections for me in the knees. That's really my main thing. But I have pain, guys, all over. So we can't be sitting here injecting every point in my body. That works. I'm going to say that works. But it's not long lasting. Like, I really need something long lasting and something that I can do to prevent pain. Because right now I'm at the point where I'm always in pain, but we want to keep it at a certain level versus, allowing it to get here, and then there's little to nothing that we can do, and I'm in flare and I'm admitted into the hospital. So that's my goal. Hopefully that's their goal. So I've also tried some narcotics. Like I said, I was taking oxycodone, hydrocodone, tramadol, which is like amped up Tylenol. Just nothing. So, I've been doing my own research as to like what's next when nothing is working for you like that. So, I know what's next, what the extreme is. More than likely, they may start me or give me an option to do the extreme, but I don't know. We'll see. Usually your first time going somewhere, they're not going to do that. But like I said, I've already been where people have been, in pain management before I even got there. So they may start at the extreme, which is definitely, which one option is like to have a spinal surgery. Crazy. Like, I definitely do not want to do that. I mean, guys, like, I haven't even thought about it, and I'm about to sit here and cry just, thinking about that. Like, I don't want to do that. Like, what? Definitely do not want to do that. I already possibly have another surgery coming up that I'll talk about later, but I definitely don't want to do nothing like that. Like, I don't want anybody messing with my spine at all, because knowing me, I end up paralyzed. Something end up happening ridiculous. So no, I do not want to do anything like that. And then the second thing would be to do an abdominal pain pump, which is like a little device that they put in your abdomen that constantly administers pain medicine directly into, your spinal cord. And they just put a catheter, so it's not like they're really going into your spine. So they put a catheter from that pain pump in your abdomen to your to your spine, just a small little catheter, like an IV, tube, that type of thing. Nothing serious. So I wouldn't mind doing that, but that is so extreme. Like, I wish I wasn't even at this point. I'm just thinking about it like, that is extreme. But guys, I'm like, almost like whatever I gotta do. Like, I want to get back to working. I want to get back to even just being able to go 30, 45 minutes away to see my friends. Like, I used to drive all the time back and forth to the location where I used to work during college to Decatur from Huntsville, and I can't even drive. And, and it's just ridiculous. So I can do it every once in a while, and when I do it, it's like, oh, great, you made it. I'm glad you were able to go out there and hang out, but y'all don't see me after I do it. Like, I'm in pain. I'm tingling all over. My nerves is all jacked up, when I do anything physical. So I just don't know. So that's an option, but my doctor haven't given me that option yet. So we'll see. And I'm definitely not suggesting it because I'm still just like, hold on, like this is a lot. Like, this is something to really think about, because that's something being implanted into your body. And I already have something implanted in my body, which is my port. So that'd be a second thing that's not really supposed to be there. But then again, you do also have to think about, you have to do what you have to do to take care of yourself, no matter pretty much what it is. Like, if it's foreign objects that have to be implanted, I mean, people get metal rods placed in them. You have to do what you have to do, whether you like it or not. And I'm telling you, I don't like any of this. Like, I am so tired and frustrated. Sometimes, like, it don't even hit me. Like, sometimes I'm just sitting here thinking, like, am I really going through this? Like, I don't even know if it's came down on me yet. Like, I don't think I've had a breakdown or nothing yet, because I'm just thinking, like, I can't believe this is happening. Like, any of it. Like, I just sometimes don't even believe it. But, I know it's going down. Like, for real, it's going down. So, yeah, so that's the plan with that. Actually go very soon, next week. So I will update everybody and talk about my first experience there. And I'll tell you guys how that goes. Second thing is, you guys hear about, like, my lupus neuropathy and stomach issues with lupus and all that, gastroparesis a lot. But some of you guys didn't even know that that I did have lymphoma, cancer. And when I'm saying I did have it, we'll see. So, and that's the crazy thing about it, guys. 9 years ago, pretty much almost 9.5 years ago, I was diagnosed with cancer. And I'm coming up on my 10th year being cancer-free, and at this point, we're questioning the return of cancer. So, I had posted on my Facebook, if you follow me on Facebook, how I'm probably going to have a surgery because I have a lot of abnormal cells right now in my pelvic area, and that's where my cancer was before. It was in my pelvic and my femoral. And so right now, they don't feel like it's time to go in and do the surgery yet and start scraping stuff out, pulling stuff, whatever they got to do in surgery. They don't feel like it's time just yet. They want to give it 6 months, go back, retest, see if it's still the same or gotten worse. So even if it's gotten worse, they don't think that it will turn cancerous. And so while I'm in the appointment, I'm just like, okay, I have these precancerous cells that are going crazy in my lupus body right now, and you guys want to wait 6 months. I'm thinking, like, y'all don't know lupus. Like, y'all don't know, because my body, if this was 2 years ago, I'd be like, yeah, let's wait 6 months, let's wait a year, cool. But in the last year, in the last 6 months, I'm messed up. Like, I am so messed up. And when you're on like immunosuppressants, which I am on 3 different types of immunosuppressants, it makes your body harder to fight off cancer or cancerous cells or precancerous cells. So I'm on these things, and we want to wait 6 months to remove them because we want to see if it's going to get worse. Okay, I understand the medical side of it. Oh, let's recheck. Let's give it a few months to see. I definitely understand that, but you also sometimes doctors have to think about the other things you got on, like I just explained to you. Like, it just makes no sense why you should wait. Like, if I wasn't like this, if I didn't have lupus and I wasn't on these other medications that I cannot come off of, then I would be like, yeah, let's wait. I'm definitely wouldn't be in a rush. And I'm definitely not in a rush now because I have decided and agreed with them that we are going to wait because I already have a lot going on. And at this point, coming off my medicines, like my immunosuppressants that's supposed to help my lupus, it's not an option. So it's almost kind of like you have to decide between, are you going to continue to treat your lupus this way with immunosuppressants, or are you going to keep your body at risk by taking them for cancer? So that's crazy. So I've decided, that I'm going to have to keep my body at risk because, as you guys probably see that I've expressed before, I think based on my experience, because I have both lupus and cancer, that lupus is way worse than cancer. So, not saying that I would want to have cancer because I don't want it to turn that way. But I definitely choose, if I had to choose, I know that the lupus is not going to go away if I get cancer. So, if I had to choose between the two, I would honestly choose lymphoma again. If I had to choose. So, because I know we can knock that out. We have some, just like, we'll have some rounds of chemo. Anytime your cancer comes back, when you already had cancer or in chemo, like, they say it's usually worse or harder to treat. So that's the only thing that I'm afraid about. It won't be as a breeze as it was before, but, bruh, I choose 13 rounds of chemo versus what I have to go through every day with lupus. So that's where we are right now, in my cancer journey. So we're back on that. We are back on that. And I'm just like, okay, we're going to be all right. We're going to get through this. However it turns out, we'll just see. So that's been another thing. Trying to think. I've started one new medication? Yeah, one new medication. I don't know how to pronounce it, so I'm not going to tell you what it is, but give you just a little description of how it works. But my GI doctor prescribed it to me because we know that lupus is attacking my gastro area. So, like, stomach, obviously my gallbladder, because it had to go. They had to take it out because it was overreactive. My intestines. My whole digestive tract, lupus likes to attack. So, my doctor is at the point where we're like, my GI doctor's like, we know you have lupus, so we can say that lupus is attacking your GI, but do you have another autoimmune disease? I'm just like, are you kidding me? Do you really think, are we really having this discussion? Like, do you really think that I have another autoimmune disease? So, he's thinking like something like colitis or Crohn's, and I'm just like, oh my gosh, like I have the symptoms, but dang, I don't want to hear that I have it, with especially with everything else going on. But it's always good to know what's going on. So I'm just talking. But so he's just like, okay, I'm gonna try this medicine on you that we use on people with different types of colitis and Crohn's, and it's basically a steroid for your stomach specifically. It's not like a high dose type of steroid like I take the prednisone, but it's not absorbed like how he explained it to me. I guess he dumbed it down, but I hope he explained it correctly. But how he explained it was the steroid works directly in your stomach and it's not distributed to like your other organs. So because that's a concern when you're already on high dose steroids and then you take more steroids, that can have a negative effect like on your other organs like your kidney and your liver and pancreas and stuff like that. So that's one reason why he explained to me how it works, because he knows that I'm already on a high dose steroid. So he was like, we're going to try this because you know that when you have one autoimmune disease, which I have like 3 going on, which I have like 3 autoimmune diseases going on right now, it's definitely possible. So I'm like, okay, is there medical testing, And there is medical testing, and the thing about it is when you have some of these autoimmune diseases, that's why it's hard. The same tests, some of the same like blood tests will determine like other autoimmune diseases. So we already know my ANA is positive. So obviously I have some type of autoimmune disease, which we know which ones they are right now. And so really further testing wouldn't tell him anything. So it's kind of just to see, is this medicine going to work for you? But I can also just be inflamed because of lupus, but he thinks it's a little bit more to it. But to be honest, I don't even care because the treatment for all this stuff is the same. Like some people with Crohn's, they get treated with Humira and Enbrel. Like people with rheumatoid arthritis like me get that type of treatment. So it's kind of just like, that's just one to add onto my record, but I'm already being treated for it if I do have it. So I don't know if he'll amp up, my drugs to something else, like more injections or infusions, because he did ask me if I was getting any type of infusion or have I had any type of infusion for steroids. And I was like, what do you mean? Because at this point, I'm not trying to get I'm not supposed to, and I haven't told my rheumatologist yet, I'm not supposed to be having any more steroids than what I'm having right now, because I'm supposed to be trying to get down on them. As y'all saw in my last video when I introduced pretty much to you my rheumatologist, that was you guys' first time seeing him in the video. So he was telling me, okay, it's time to come down from 24 to 18, and then you can't have any injections, so you hit 12 milligrams. And I'm just like, and guess what I've done? Have not came down. It's been 2 months. It's winter time. It's like, I'm like, what do you guys not understand? Like, it's winter time. I'm about to get so bad off. Like, I'm not coming down off of that. I'm not coming down any lower than what I'm already on. And, that's just not about, that's just not about to happen. So I've decided though that I am going to try, because I'm definitely at risk for diabetes. 1, because I have lupus, it can attack my kidney and I would have to have dialysis. And then 2, my levels are high as far as diabetes because of the steroids that I'm on. So I've decided to try. Hence, I am laying down. I have not been able to really move the last few days, but to go to my doctor's appointments this week, which totally sucks. because, of course, I would like to do other things, but I haven't been able to. This past, week and a half, 2 weeks. These past 2 weeks, I've pretty much just been at home. So yeah, it sucks. Yeah. So from there, I think that is all as far as updates to my hair. Yeah, I mean, I cut it, but it's growing back. The last time you saw it, it was black. Now it's like honey blonde, and I'm probably about to dye it again. Back to black. Don't know yet. So yeah, I'm gonna do, this video is pretty long, about 30 minutes, but I had a lot to update. Like I said, it's been 2 months. So I'm gonna do some more videos. I'm gonna do a Q&A. So this is how it's gonna go. You can ask me any question you like. It doesn't have to be like, oh, so what is lupus? Oh no, what is this about lupus or arthritis or gastropro? No, just ask me any life question. Or if you're concerned, like, how has this changed in your life because of lupus? Like, or if you just want to know. So I'm definitely going to answer all the questions, but I would definitely put a medical twist to it. How it has, certain things have changed, like traveling has changed for me. And so if you have a question about traveling, do you like to travel? Yes, I like to travel, but da-da-da-da-da. So I'm going to do a Q&A. So definitely ask me any questions that you might want to, anything personal. You guys obviously know I will tell you. But that's what I'm doing as far as videos. And I am going to try to do a video from now on and get one out, let's see, by Sunday. Every Sunday. So that's my goal. Of course, it'll be better quality like this, but I can't always, better quality than this, sorry, not like this. But I can't always guarantee that because look at me right now. Like, I can't really move right now. So, hopefully it'll be better quality. But I did buy a camera. I know I had talked about that. I bought a camera Black Friday, and it was crazy out there. We were in Orlando. Our family got a chance to get away. We really, really needed a vacation. So we met up with our other family that's actually from the Fort Lauderdale area. And, our family has Thanksgiving every year in Orlando at the resort. Pretty much you go from Sunday to Sunday all week. And I haven't been able to go for years because of school, work, this and that, money, obviously illness. So I'm so glad we got a chance to go. I had one bad night when I was there. Of course, every day was a bad day health-wise, but we still made it good days. I don't share when I'm feeling really bad with people. I just went and got in the hot tub, guys. Every day, if not twice a day. So that's what I did to kind of help ease some of like my muscular and joint pain while I was there. Of course, I took my medicine faithfully. But yes, so Black Friday was crazy. Around 6 o'clock, me and my friend went to Target, which was like right across the street from the resort area. And when I say right across the street, honestly, it was not across the street. Like, it takes almost 10 minutes just to get out of the resort because it is so big. And we were like towards the back of the resort. Like, literally, if you walked a little bit through the woods, you would be in Disney's parking lot, in the back of Animal Kingdom somewhere, probably in the little jungle area where they're taking on the safari. And I did go to Animal Kingdom. But so we drove to, we went to Target. Thank God my friend was there because, guys, it was so many people there. One, I can't walk fast. And two, like, I was really trying. Like, I couldn't see, like, I'm so short, so I couldn't see the signs, like, where certain things were because people were so crowded. So thank God my friend was there. and he was able to like, you know, see kind of like over these people, you know, whatever. So we got in and out, and I got a new camera. I got a GoPro, which I have already tested out and used when we went to Animal Kingdom that next day. So I'm going to probably edit that video and then post that. That won't be a part of my Sunday video. That'll just be a little extra bonus. But I'm going to edit that video and post it, you know, see what it's looking like. But I'm so excited about my GoPro because it is so, like, it's so small. It's kind of discreet when you're recording. It has a little handle thing that you hold, but, you know, I had to get the whole kit. So I ended up, while my family and I was out, it wasn't even Black Friday with Target. We went at 6 o'clock, like right before Thanksgiving dinner. And I know you guys are probably like, y'all eat dinner at 6 o'clock? Yes, we do. So, so that Friday I went to Best Buy and got the whole kit where it has all of the gear, like the chest harness for your GoPro, you know, all the clips. So if I want to clip it onto my car when I'm driving, because you guys know I like to talk while I'm driving, that just actually distracts me from my pain. So I'm always on the phone. If I'm not blogging when I'm in the car driving, whenever I'm driving, I hardly drive, you know, I'm talking to somebody. Like I'm calling my best friend or an aunt or somebody or my parents to distract me from the pain. So it has it has a little mount for that. It has different little clips. Like if you want to put on your hat if you're doing something adventurous, which I am about to, by God's grace. It's in a plan, but we will see. The GoPro's also waterproof, so I'm excited about that. So if it ever fell in something or got wet, you know, thank God, nothing's going to happen to it. So it's just a win-win. So I'm going to be using that to record from now on. I probably won't be recording too much on my laptop unless I do something like this where I can't really move, or for some reason I might record from my phone if, say, I didn't plan on blogging and something happened and I just brought it out. You know, I didn't have my GoPro with me or it's not charged or anything like that. So that's what's going to happen from now on. I'm very excited about that. Now, so I think this is the end of the video. It's been like 40 minutes almost. But I enjoyed talking this out. I know some of y'all have been wondering, sending me messages like, are you in the hospital again? Like my doctor even asked me, have you been in the hospital since? Like, they know. They know because they be scheming. They be scheming on me. They be talking to each other and like, oh, we admitting her. That's not going to happen. So I have a lot of more doctor's appointments. Since I have my GoPro now, I'm going to be taking you guys along on my doctor's visits. Like, maybe not this first pain management visit because it's going to be pretty long and kind of introductory. But I will be taking you along to my next, since you see my rheumatologist, I won't take you there. But I will take you along to my hematologist visit, which is coming up, not this week coming, but the following week. And then I'll be spending 3 days at St. Jude's. And you guys have not seen any of St. Jude's because I did not blog my cancer experience, 9 years ago. Everything just happened so fast. I was 16. I hardly remember much of it. I only remember emergency situations and big things that happened. It was just crazy. So I will be blogging my 3 days when I go to St. Jude, so you guys can see the place, kind of see what happens when I go. Of course, I won't be able to blog, if I go into a scan, you guys won't be able to see that, but I'll come back and explain it later. So just stay tuned. It may be a lot more videos coming out than once a week on Sunday, like when I have appointments like this. So just continue to stay tuned. Subscribe if you have not subscribed. If you want notifications, you can always hit that little bell. It should be next to the subscribe button unless YouTube has changed it, People and companies always changing stuff. So you can hit the bell and you can get notifications whenever I get a new video that comes out. So yeah, that's pretty much it. I will see you guys later, and I will be working on uploading that video of Animal Kingdom. So yeah. All right. Well, you guys have a blessed weekend. I hope you guys had a happy Thanksgiving. And I'm going to say Merry Christmas just in case you don't see any of my other videos that I post coming up. But this definitely won't be the last before Christmas. So yeah. See you guys later.